Got 47 attendees here already out of the 61 that were registered. So I think mostly everybody's here. Good morning, everyone. I hope you're not too soaked from the downpour outside. My name is Beth McConnell. I'm the Director of Policy with the City of Philadelphia's Office of Community Empowerment and Opportunity. Our role here today is simply just hosting this webinar on our Zoom channel. Maripat with Community Legal Services is going to kick off the webinar in a second and talk about the big changes that are coming to medical assistance and what benefits counselors and advocates, outreach folks need to know to assist Philadelphians in trying to make sure as many of them as possible keep healthcare coverage or get some form of healthcare coverage. I just want to say briefly a few words about community legal services and Maripat. I mean, I think there are a few organizations in the city that do as much as CLS do. A lot of great nonprofits out there, but they always do such an incredible job. Maripat specifically and the whole team at CLS, you know, advocating on behalf of low-income Philadelphians, providing them just excellent legal support and partnering with the city, so many city departments on outreach and engagement and in policy issues. And Maripat has really done an amazing job of coalescing a lot of stakeholders inside city government and outside partners and making sure we're working together and coordinating with each other around these changes to medical assistance because it's going to affect an awful lot of people. So I want to thank her so much for all of the work that she's been doing on this and for joining, for doing this training for us all today. So with that, I'm going to kick it over to Maripat, but just a quick logistical announcements. If you have questions, please use the Q&A function at the bottom of the screen. We'll be paying close attention to that to make sure we get to those questions. I would prefer that you not use the chat for questions, just because sometimes lots of stuff can get in there and can get lost. But you can feel free to use the chat if you want to introduce yourself, say who you are, where you're from. And when we do the Q&A, we'll give you the, you know, in some questions I might just ask them verbally, but in other cases I might unmute you or give you the opportunity to unmute so that you can ask your question verbally. We'll kind of take them one at a time as we get to that. I'm seeing a question from someone in the chat about whether anyone can hear. Can people hear me okay? Okay, looks like lots of people can hear, so maybe that one person's just having trouble. Okay, great. So with that, I'm going to go out on mute and off camera and turn it over to Maripat.
Wonderful. Thank you. Thank you, Beth. Thank you to everyone who has joined today. I was able to see a lot of the folks who are accepting the invitation, so I know I can't see you physically, but I know a lot of you out there. I saw a lot of them. Benefits counselors who I have worked with over the years whenever a client of mine happens to be a patient of yours, the Benephili folks who I've worked with when they send referrals over to CLS, of course, the folks at the Medical Legal Partnerships at PLA and other advocates and application assisters. I'm so glad that so many of you were able to join. I have less than an hour and a half worth of a presentation to give you. So we are going to save time at the end for questions and answers. So please, as your questions come up as I'm talking, please, like Beth said, please put them in the Q&A function. I'm just gonna take a quick look at the chat, make sure that nobody's saying they can't hear me. I don't see any of that, so I think we're good. So my name is Maripat. I'm a lawyer at Community Legal Services. I work in the Health and Independence Unit at CLS, and my unit does pretty much all of the state public benefits work that is done at CLS. So state public benefits include medical assistance, but also things like SNAP and cash assistance and LIHEAP and child care subsidy, stuff like that. So that's what I do. And I'm here today to talk to you all about the changes that are coming starting April 1st in the medical assistance program. If you have a question after today, you can email me and I will try to help. This is my email address right here. Please feel free to use it if you have questions after today's presentation. All right, let's get started because we have a lot to cover. Okay, so this is what we are going to cover today. We're going to talk about what is changing and when. We're going to talk about the renewal process, the medical assistance renewal process. I know a lot of you out there have done a lot of medical assistance renewals in the past, but the last 3 years have been a strange time for medical assistance. So some of us might find a renewal process refresher helpful. So we're going to do that. As I'm talking, I'm going to talk to you a little bit, give you some reminders about medical assistance eligibility and some of the programs that sometimes we forget about. And it's going to be pretty important to remember programs like MAUD and PH95 when we're thinking about whether folks should keep their medical assistance or not during this unwinding period that will be starting on April 1st. We're going to talk about how to handle a medical assistance cutoff and what you can do if you are cut off, but you can't get back on because you're ineligible for medical assistance. So the other healthcare options that are out there for people. And then at the end, I have one slide on some tips that folks can do to help themselves get ready for this unwinding period now before April 1st. All right, before I get into this agenda and the nitty gritty, the next few slides I'm going to show you are going to look a little complicated. They're less complicated than they look. But so before I get to the complicated looking slide, I just wanted to put these top line messages in your head now so that you have them there and maybe can keep thinking about them as I continue to talk and talk about the more complicated stuff. So the first thing is, people on medical assistance will need to take action to keep their medical assistance on after April 1st. There have been special COVID rules that have been in place since March 2020, so 3 years. Those rules are ending, and they will no longer work to keep medical assistance on automatically. So after April 1st, folks will need to get their medical assistance renewals in, and they will need to respond to verification requests in order to keep their medical assistance on. So things are going to change. Things are not going to look like they have over the last 3 years, starting April 1st. We expect that a lot of people are going to fall through the cracks during this unwinding period starting April 1st. We expect that the county assistance offices won't be able to keep up with all the work that they have. So we expect that a lot of folks who shouldn't get medical assistance cutoff notices will. So we're going to talk about today appeal, right? Appeal is the main kind of advocacy point that I want you all to kind of leave with today about MA cutoffs. Get your appeal in. It preserves people's rights to any medical assistance benefits that they might have lost, and it gives people more time to figure out what the problem is and get it fixed with the county assistance office. Even if people miss the appeal deadlines, they can always reapply. There's no open enrollment period for medical assistance. You can reapply for medical assistance at any time. And if you are actually ineligible for medical assistance, there are other healthcare options available to you. So those are the top line key messages for today. So now let's get into the agenda. What is changing and when? So this is my attempt at a timeline here to give you kind of a brief overview of the key dates and terms that you will hear thrown around today and probably in other places too, as people talk more and more about the unwinding. So before COVID, remember then? So before March 2020, I have that in yellow. And then I have this continuous coverage period, which we are still in now. We are still inside the continuous coverage period. And then starting April 1st, we'll start this period of time that folks are generally referring to as the unwinding. The dates here that are key are March 1st is March 18th, 2020. The Federal Families First Coronavirus Relief Act, the FFCRA, requires states to keep everyone enrolled in medical assistance throughout the public health emergency if they were enrolled in medical assistance on or after March 18th, 2020. So this period of time that started on March 18th, 2020 is referred to as the continuous coverage requirement period, continuous coverage period. So it's called that because states were required to keep people continually covered by their medical assistants throughout this period of time during the public health emergency. Then on December 29th, 2022, just this past December, Congress passed another law, the Consolidated Appropriations Act, that ended the FFCRA's continuous coverage requirements starting April 1st, 2023. So the continuous coverage period, at first it was defined by how long the COVID public health emergency was going to last, but then this latest law said, nope, COVID public health emergency doesn't matter anymore. The continuous coverage period is going to end on April 1st, 2023, whether there's a COVID public health emergency or not. So that just happened December. March 1st, 2023, this will be when the state Department of Human Services, Pennsylvania Department of Human Services, will begin sending out renewal packages that are due in April. And these will be the first renewal packages since March 18th, 2020, that can actually result in a medical assistance termination if they are not done on time. So March 1st, 2023 is kind of the first step in the unwinding, even though it's before April 1st. And then of course there's April 1st. April 1st is when the continuous coverage period ends and medical assistance terminations can begin again. All right. A little bit more about what was happening within these different periods of time. So before COVID, you might remember if you were doing medical assistance work before March 2020. Before COVID, everybody on medical assistance had to do a medical assistance renewal once per year. If the renewal was not done on time, MA could be turned off. If the renewal was completed on time, but showed that the person was ineligible for medical assistance could be turned off. During the continuous coverage period, that was very different, right? Everyone on medical assistance got a renewal once per year. They got their renewal in the mail. But if you didn't do the renewal, your medical assistance stayed on. It wasn't cut off. Or if you did do your renewal, but the renewal showed that you were ineligible, so like maybe your income had gone up and now you're not eligible for medical assistance anymore, your medical assistance would still stay on, right? Because we're in this continuous coverage period. States were required to keep everybody on. During the unwinding, everyone will get a renewal once a year, and they have to do the renewal once per year. And the renewal during the unwinding period will be due either 1 year from the last renewal due date, or 1 year after the date that medical assistance was first turned on. And just like before COVID, if the renewal is not done on time, medical assistance can be turned off. If the renewal is done on time, but it shows that the person is ineligible, then medical assistance can be turned off. Okay, so these, there's been a lot of kind of talk, and the state has gone back and forth about when these renewals will be due during the unwinding period. And people are a little confused about when their renewal is going to be due during the unwinding period. Is everybody going to have to do their renewals all at once, or are they going to be spread out? So I have a few examples in the next slide just to kind of flesh out a little bit what this means. Like, what does it mean to have your renewal due 1 year after your last renewal was due, or 1 year after your medical assistance was first turned on? So I think the best way to kind of think about this is just to put it in kind of these hypothetical terms. It helps to kind of understand them a little bit better. So renewal due dates during the unwinding. Here are some examples. The first is Mary. She's been receiving medical assistance since before COVID, since November 2015. That's when she first got on. She's faithfully renewed her medical assistance in November every year. But this past November 2022, she was in the hospital when her renewal came in the mail, and she was so busy with her follow-up care when she got home that she missed the renewal entirely. So she never did her renewal in November 2022. But her medical assistance was never cut off because of the continuous coverage requirement. So when will Mary's renewal next be due? Next renewal be due, right? We have this April 1st unwinding. April 1st is when people's MA can be turned off again. She didn't do her renewal, so technically she's not eligible right now. What's going to happen to Mary on April 1st? Now I know you can't chime in, right? Because we're in webinar mode. But I left the answer here blank just to give you a second to think about it. The answer is actually a little bit simpler than it might seem. Mary's next renewal will be due November 2023. It's 1 year after her last renewal was due. Her last renewal was due in November 2022. So her next renewal will be due in November 2023. It doesn't matter that she never did her November 2022 renewal. So come April, she won't have to do anything. The next time she's going to have to do something is in November 2023. What will happen if she doesn't do that renewal in November 2023? She'll get a medical assistance termination notice, right? So unlike when she missed her November 2022 renewal, if she misses her November 2023 renewal, she will get an MA termination notice and she can lose her medical assistance. The continuous coverage period will be over by November 2023. So she's got to do that renewal in order to keep her MA. Okay, so that's Mary. Next, we have Daryl. Daryl first started getting medical assistance in January 2022, so just about a little over a year ago. Around the same time that his renewal was due in January 2023, he got a new job and he reported his new income on his renewal form in January 2023. His new income put him over the medical assistance income limits, but his medical assistance was not closed because of the continuous coverage requirement that was still in place in January 2023. So, County Assistance Office knows that Daryl's income puts him over medical assistance income limits. They know he's not eligible. April's right around the corner. January wasn't too long ago. When will Daryl's next renewal be due? The answer is January 2024. The unwinding period starts in April and it goes on for a full 12 months after April. So it's going to keep going until April 2024. So January 2024, we will still be in the unwinding period. Daryl, even though his income's over income limits, he will be able to keep his medical assistance until he's offered an opportunity from the state to do a full renewal. And the state's plan is to offer Daryl his first opportunity for a full renewal will come up in January 2024. So his next renewal will be due 1 year after his last renewal was due. If he doesn't do it, he will get a medical assistance termination notice. Or if he does it and his renewal shows that he's still over the income limits, he will also get a medical assistance termination notice. All right. Next, Carmen. Carmen first started getting medical assistance in August 2022. She then got a new job in October 2022, and she reported that new income to the County Assistance Office. The new income put her over medical assistance income limits, but her medical assistance was not cut off because of the continuous coverage requirement. So she's a lot like Daryl, except she first got on medical assistance in August 2022. She has never had a renewal due before. She hasn't had medical assistance for a year yet, so she hasn't been offered any opportunity ever to do a medical assistance renewal. Situation is the same for Carmen. Her medical assistance renewal will be due in August 2023. If she doesn't do it, her medical assistance could be cut off, or if she does do the renewal in August 2023, and it shows that she's still over the income limits, then she can get a medical termination notice. All right, last example. Samuel, been getting medical assistance since April 2020, so right after COVID started. He did his renewals in April 2021, and he did his renewal in April 2022, and each renewal showed that he remains eligible for medical assistance. So Samuel is the only person here, right, who's we know is actually eligible for medical assistance right now. He's done all his renewals when he was supposed to. He's actually substantively eligible for medical assistance. For Samuel, his renewal due date is in April. His next renewal is going to be due in April 2023. So he's going to be in that first group of people who could potentially get their medical assistance cut off in April if he doesn't do his next renewal on time, right? So he's actually going to be at risk of medical assistance termination potentially before any of the other folks we've talked about today. If he doesn't do it, he will get a medical assistance termination notice. All right, so hopefully that's clear, right? It's not like everybody's going to have to do everything in April. This is going to start in April and continue for a full 12 months. Everyone will have, during those full 12 months, everyone on medical assistance will have an opportunity to do a renewal. And that renewal due date will be either 1 year after their last renewal due date or 1 year after they first got on medical assistance, whichever one applies. I will say there's a very small group of people who will have their renewal date slightly shifted. People who, there's also a renewal due date for SNAP. So people have to do an annual renewal for SNAP. If somebody's medical assistance renewal due date is currently different than their SNAP renewal due date, the state is going to align those renewal due dates, move the medical assistance renewal due date to match the SNAP renewal due date, so that people only had to do one renewal in this upcoming year rather than two. It's a very small group of people. Most people already have their SNAP and medical assistance renewal deadlines aligned because most people get on both benefits at the same time. But it's a small group of people. I think it's like, if I'm remembering correctly, it's around like 30,000 people across the entire state. So it's a very small group of people, but there will be that little bit of reshuffling of renewal due dates for some people. All right. So you might be asking yourself, all right, look, okay, what's the big deal, Maripat? Okay, so everybody's just gonna have to do renewals like they had to do them before. Like, what is the big deal? I can say a lot about this, but I'll just say these 3 points here for now. The first is there are a whole lot more people on medical assistance now than there ever have been before. There are nearly 1 million more people on medical assistance now in Pennsylvania than there were before COVID. Many of those people got on medical assistance for the first time during COVID, so they've never had to do a renewal before or otherwise really have had to interact with the county assistance office in order to keep their medical assistance on. So this is going to be new for a whole lot of people. The second point, the county assistance offices are understaffed, and a lot of the staff who were there were hired in the last 3 years, so they don't have a lot of experience handling medical assistance renewals. This problem with staffing at the county assistance offices is true across the state, but it's especially bad here in Philly. There are more than 200 clerical positions alone that are unfilled in Philadelphia. So, so that's a problem, right? We're worried that there just won't be enough people to process all of the paperwork that's coming in. Last point that I'll make is that even before COVID, there were a whole lot of eligible people who would get their medical assistance cut off at renewal just because of procedural problems like missing paperwork or mail delays or something like that. Before COVID, it was about 100,000 people a month, every month across the state who had their medical assistance cut off for these procedural reasons, even though they were eligible. So now, because there are so many more people on medical assistance, and because the county assistance offices aren't staffed up in ways that can really meet the need of all those people, we are really afraid that that problem of eligible people getting cut off because of missing paperwork or delays will be a whole lot worse during the unwinding period than it was before COVID. So that's why we need you all out there, right, to know about this problem and to be armed with good information about how people can get their renewals done on time, so that as few people as possible are getting cut off medical assistance when they shouldn't be. So that's why I have these following slides, so that hopefully you all can get some good information that you can use to help people stay connected to medical assistance during this unwinding period. All right. So we're going to talk about the renewal process a little bit. Before the renewal is due, the first things that people will start getting from Pennsylvania DHS are letters, and then they will get some emails, and then they will get helper calls, and then they will get text messages if they're signed up for text messaging. All of that will start 90 days before their renewal is due. PADHS has samples of all of these communications available for the public. So you can take a look at this link here and check it out. You can see what people will be getting. Excuse me. And then the month before the renewal is due, the renewal package will go out to the medical assistance recipient in the mail. And the renewal package will have the renewal due date right on the front page. That renewal due date, of course, is very important. It tells people when they need to get all of that renewal material over to the county assistance office in order for it to be timely. I have here, like I said, you can click on that link to see all of these different communications, samples of all these different communications that people will be sent. I put a few of them in here just so you can take a look. You might have already seen people with this letter. They're calling this the targeted mailing. And it's the goal of this letter is to get people to know that they have to take action to keep their medical assistance. Like, things are different now. You have to actually do the renewal if you want to keep your medical assistance. This is one of the emails that they're going to be sending people whose email address they have. This is one of the text messages that they'll be sending people who are signed up for texts. DHS started texting people like a year or two ago. And I think what they did is they just automatically signed everybody up for texting if they had a phone number for that person, if that accepts texts. But we'll talk at the end about what people can do to sign up for texts if they're not already signed up. So it's important, I think, for you all to see these things so that if people come to you with, they're like, what is this text message? Because people get, I'm sure everybody on this Zoom webinar gets weird texts from places you don't know, right? And sometimes it's actually spam and phishing, but this is not, right? This is legit. This is a text message from the Department of Human Services, and people should pay attention to it. All right, so you get all these different communications from PADHS letting you know that your renewal is going to be due soon, and now it's time for you to actually do the renewal. The renewal package, the paper renewal package itself is, when you open it, it feels a little daunting, right? Because it's kind of thick. I don't know, say maybe like 20 pages thick when you count up everything that they send to you in that package. But the key part of it is the renewal form, the PA 600R. And sometimes the PA 600R has some of the fields already filled in for you, so people don't have to put in their name and their address again, right? If PADHS already knows that information. But the questions that aren't answered need to be answered. Of course, people can also do this on Compass, right? And there's an online form to fill out on Compass to complete your renewal on Compass. Hopefully everybody knows that Compass is PADHS's online application platform, COMPASS. So the renewal can be done there too. You need to verify changes. So if your income has changed, verification of your new income. If resources are applicable to you in your medical assistance category, you'll have to verify resource changes. I wanted to highlight this last verification piece for all of the folks out there working in health clinics, and I know there are a bunch of you out there now. People might need to prove that their disabilities or their emergency medical conditions are still continuing, right? So people who got on medical assistance in a disability category, for example, might have submitted a PA 1663, an employability assessment form, sometime during the continuous coverage period. But the disability form expired long ago, but medical assistance was never turned off because of the continuous coverage requirement, right? So at that point, so when this person's renewal comes up, they're going to have to get a new PA 1663 employability assessment form to verify that their disability continues so that they can keep getting medical assistance in that disability category. Same thing with emergency medical conditions. If an immigrant is getting emergency medical assistance and the emergency medical condition form that they submitted long ago has now expired, they're going to need to get a new one to verify that their emergency medical condition continues in order to have any shot at being able to keep their emergency medical assistance. All of the forms I mentioned on this slide are available publicly. This link here will take you to them. I've put in my slides here the forms that I mentioned that people need in order to prove things about their medical conditions, their health. And so this is the employability assessment form. Hopefully most people, if not all people on this call, have seen this slide before, this form before. This is the form that adults use to verify disabilities for medical assistance purposes. Oops, sorry. This is the PA 1920. This is a fairly new form. I don't think it was around before COVID. I think it came out right after COVID started. This is a form that can be used to verify disabilities in children. And then this is the emergency medical condition form for immigrants receiving emergency medical assistance. So I'm not going to talk a whole lot about these forms today. I just wanted people to be able to see them, to be like, oh yeah, I remember that form, right? People might need them again. So keep your eye out for them. And if you can, if you're in a place where there are doctors available or nurse practitioners or physician's assistants who can help folks get these forms done, that will be incredibly helpful to people during this renewal process. All right. Some more tips about verification. So it's not just health concerns that people will need to verify. They're going to need to verify other stuff. My main thing that I want everybody to know is that if people are giving paper, sending paper to the county assistance office, they should keep a copy of it and get a receipt showing that they submitted it if they can. If they're bringing it to the county assistance office directly, there is the drop boxes at the county assistance office. You can make a receipt showing what you left in the drop box. There are also copy machines at the county assistance offices that people should be able to use to make copies of what they're leaving there. If you're mailing things, I know this is expensive, but if people can mail things, certified mail, so they have proof of when they mailed it, that would be incredibly helpful. There is almost never just one way to prove anything. The thing this comes up a lot with proving income, right? The county assistance office tends to just say, like, show me your pay stubs. But there are lots of different ways to prove income. You can get a letter from your employer. If your employer won't give you a letter, you can submit your own sworn statement about what your income is. And And there are probably even more ways out there to prove what somebody's income is. The point is, it's okay for people to kind of think outside the box that the county assistance office might offer them when it comes to verification, and think about what kind of documentation they have or can get to verify the thing that needs to be verified. You can also ask, wait, do you even need this proof at all, right? The county assistance office has access to a lot of databases that they can use to verify things on their own. They're in direct contact with the Social Security Administration, so they should already know what people's income is if that income comes from the Social Security Administration. They get data matches from that link up with IRS data. That can be helpful sometimes for like self-employed people who maybe their only proof of income is their tax return, for example. The work number is kind of like this data dump warehouse, kind of electronic warehouse for a lot of bigger employers, where they just upload all of their payroll data, and then agencies like the Department of Human Services, the County Assistance Office, can access this database to get payroll info directly. So, you know, if somebody's working at Target or Walmart or lots and lots of other places, probably their information is already available to the CAO through the work number. The CAO has an asset verification system, which gives the CAO direct information about what's inside people's bank accounts. It's a monthly snapshot, so it doesn't give the CAO information about what's coming in and out all the time, but it gives like, okay, this is what is in here now on this day of the month. But that can be useful to people who are having trouble verifying what their resources are. If somebody's having trouble getting a document that's needed, they can always ask the CAO for help. Ask the CAO to make a collateral contact, which basically means pick up the phone and call, right? So, I mean, like if somebody's trying to get their employer to write a letter about their income and the employer just keeps like putting it off and not getting it done, you could ask the CAO to just pick up the phone and call the employer directly and get the verification that way. If you're having trouble getting a document and you're trying to get it, make sure the county assistance office knows about that. There's a rule that says that as long as somebody's cooperating and trying to get the verification that's requested, medical assistance shouldn't be terminated for failure to verify to get the document that they're trying to get. All right. So once you get it all together, ready to submit, you can submit it a few different ways. I mentioned Compass already. You can submit the renewal on Compass. You can upload documents on Compass. You can submit your renewal by phone. A lot of people don't know this, but you can. It's called the Consumer Service Center, which is different than the Customer Service Center. A lot of us know the Customer Service Center, 215-560-7226. The Customer Service Center is the place you call just to you can just report a change. It used to be called the Change Center. Or you can just kind of get basic information like what's my renewal due date, that kind of stuff. Is my medical assistance on or off? But the Consumer Service Center, the number on this slide, is a number you can use to submit a new medical assistance application by phone directly with the Department of Human Services, or to submit a renewal by phone directly with the Department of Human Services. So that's an option. And then, of course, you can submit your paper renewal either by mailing it to the county assistance office or dropping it off there. Like I said before, make a copy, keep a receipt. CAOs lose things. And, as I mentioned earlier, it's going to be probably a pretty chaotic time. And so the risk of things being lost, I think, is going to go up pretty dramatically starting in April. So keep a copy, make a receipt. Make a copy, keep a receipt. If you don't know where your CAO is in Philly, there's a handy online tool you can use and punch in your address and it'll tell you which office is yours. That's that link there at the bottom. All right, so that's renewals. Now we're going to talk about what to do if you get one, if you try to get your renewal in and it doesn't go well, and you get that medical assistance termination notice in the mail. What do you do next? The first thing I think that people should try to do is get an appeal in. Appeals preserve people's rights to medical assistance if they're still eligible, and it gives them the time they need to get in any missing paperwork or otherwise or resolve whatever issue it is that led to the medical assistance termination notice being sent. Filing appeals is pretty easy. There is a form inside the termination notice. So the termination notices are also a little overwhelming because they're pretty long. They're usually between like 4 and 16 pages long, depending on how much information the CAO is trying to put in the notice. Somewhere in the middle of all those pages is the appeal form. So you can fill out that form. If you don't have that form, any piece of paper with the word appeal written on it, and the person who's filing the appeal, their signature and their date, the date they're submitting it, will work to get an appeal filed. You can bring that to the county assistance office directly, or you can mail it. Again, make a copy, keep a receipt if you can, mail it certified mail if you're mailing it, if you can. So, and keep the certified receipt, right? So that you have proof of when you mailed it. This is what that appeal form in the notice looks like. If you're looking for it, this is what you're looking for. We always ask for face-to-face hearings at CLS. If you do end up needing a hearing, a lot of these appeals end up not needing a hearing at all, right? Because people are able to, the appeal buys them the time they need to just get the issue resolved with the CAO before a hearing is even scheduled. But if you do end up needing a hearing, it's a lot easier to convince an administrative law judge that you're right if you can look them in the face. Also, I think the county assistance office doesn't like face-to-face hearings so much. So they're a little more motivated to get those appeals resolved with folks if they know that there's a face-to-face hearing that they'll have to go to otherwise. The general appeal deadline is 30 days from the date that the termination notice is mailed. So look at the postmark on the envelope. Sometimes the mailing date on the notice itself is different than the postmark. So check the postmark to see when those 30 days actually start ticking away. Could be more than 30 days if no notice is ever sent, or if a notice is sent in the wrong language. That 30-day clock doesn't start ticking until a notice is actually sent that is in the right language. If you're appealing a medical assistance cutoff, you can ask for your medical assistance to stay on while the appeal is pending. So if you get a cutoff notice that says, we're going to cut you off on April 15th, if you get that appeal in, you can say, oh no, please keep my medical assistance on after April 15th while I work with you to get this issue resolved and settle this appeal. People can come to CLS for help with these appeals in Philadelphia. We are doing in-person intake at 1410 West Erie Avenue. That's our North Philly office at Broad and Erie. And we're doing that on Tuesdays and Thursdays from 9 to 12. We also have phone intake on Mondays and Thursdays from 9 to 12. You can call, leave a voicemail, and we'll call you back. All right, if you miss the appeal deadline, all hope is not lost. You can ask for reconsideration, or you can submit a new application to get back on medical assistance. If your medical assistance is turned off at renewal, the county assistance office can, quote unquote, reconsider that medical assistance closure for up to 90 days after medical assistance was turned off. If it was turned off for some other reason, not related to a renewal, you can ask for reconsideration for up to 60 days after medical assistance was turned off. You can call up the county assistance office or the customer service center, tell them that you want reconsideration of your medical assistance cutoff. Or you can ask for reconsideration by submitting whatever paperwork was missing that led to the medical assistance cutoff in the first place. So like if your medical assistance was cut off because the county assistance office says you never sent them the verification they asked for about your income, then, you know, if your medical assistance is cut off April 30th, you have up to July 30th to submit those missing pay stubs as a way to ask for reconsideration and potentially get your medical assistance turned right back on without having to do a new application at all, just by submitting those missing pay stubs. You can, if you miss reconsideration too, or if reconsideration doesn't apply to you, you can always reapply for medical assistance at any time. There's no like open enrollment period. You don't need a special enrollment period. You can just reapply for medical assistance at any time. You can apply on Compass. You can apply by phone. You can submit a paper application. For application help in Philadelphia, of course, there is the Benephili application assisters available to help. All right. Okay. So you got a medical assistance termination notice. You tried to get back on, didn't work because turns out you're actually ineligible for medical assistance. So now what do you do? Still, all hope is not lost. There are options for you. What I want to say first is that people should remember MAUD and PH95. These programs are forgotten often. And they're really important to remember because the income limits are a lot higher than any of the other medical assistance programs that are out there. And so people might think, oh, I'm over the income limits for medical assistance. I'm just ineligible. I can't get it. But maybe you can through MAUD or PH95. So MAUD is the Medical Assistance for Workers with Disabilities program. The income limit is a whole lot higher than any other medical assistance program that's out there. For some people, it's 250% of the federal poverty line, but for some people, it's as high as 500% of the federal poverty line. It is not free, but it is a lot cheaper than private health insurance. And it comes with a full package of medical assistance benefits, which is more comprehensive than private health insurance benefits packages. There is a monthly premium of 5% of the recipient's monthly income. Most people end up paying like somewhere between like $75 and $100 a month for MAUD. You have to be between 16 and 64, ages 16 and 64. You have to be either getting a disability cash benefit or have a disability verified by a doctor or a nurse practitioner or a physician's assistant using that PA 1663 that we looked at earlier. You actually don't need to use the 1663 for MAUD, but that's usually what people use because that's the easiest thing to use. Is that form, the employability assessment form, is the PA 1663. And then you have to have a job. The job can be, you know, a job where you go to work every day and you get a pay stub and all that, or it can be a small task that you're able to do for even as little as 1 hour a week for somebody who is willing to pay you to do it, right? So it can be babysitting for an hour on Saturdays. It can be helping a neighbor get their grocery shopping done on the weekends. It can be whatever task someone is able to do despite their disability that someone else pays them to do. So keep MAUD in mind for people who think they're just over the income limits for medical assistance. And then PH95 for kids. PH95 is medical assistance for children with health concerns. The income limit actually isn't any higher, but the parent's income doesn't count at all. So as long as the child doesn't have any income of their own, usually for most kids, the countable income is zero, right? Because most kids don't have income. You got to get that 1916, that PA 1960 1960 form done. We looked at that earlier for this program for page 95. All right, so if you've considered MOD and PH 95, still over the income limit, still ineligible for medical assistance, there are other health insurance options out there. CHIP for kids through age 19. It's free for kids and families up to 200% of the federal poverty line. It is not free, but subsidized for kids and families up to between 200 and 400% of the federal poverty line. The county assistance office will transfer a medical assistance case to CHIP for a child whose income is too high for MA. So they'll send the case right over to CHIP. Penny is Pennsylvania's health insurance marketplace, also known as Obamacare. People still sometimes only know it as Obamacare. Penny has been around. It started right after COVID. Before Penny, we were using the federal health insurance marketplace. Now we have our own state health insurance marketplace, but it's the same thing, right? It's private health insurance that people can purchase with financial help from the government. That financial help is available to people with incomes up to 400% of the federal poverty line who are ineligible for medical assistance. During COVID, there was extra money put into subsidies for for marketplace insurance, so the Penny costs are lower now than they have ever been. Open enrollment for Penny is typically between November and January, but there is a special enrollment period right after medical assistance is cut off. They've made a special enrollment period of 120 days during the unwinding. If people are ineligible for MA because their income is too high, their case should be sent to Penny by the CAO. And with this special enrollment period, most folks should be able to enroll in Penny with subsidies if they need to. You can go to penny.com to apply there directly. If the CAO transfer doesn't work, sometimes the CAO transfer to Penny does not work well. So people can just go to penny.com directly to take matters into their own hands. They can also call FAN, Pennsylvania Health Access Network, is an awesome advocacy group who also does application assistance for lots of health insurance programs, including Penny. All right, Medicare. Medicare is generally available to people over age 65 and to people who have received Social Security disability benefits for more than 2 years. This is Social Security disability, not SSI. SSI is different. If you're on SSI, you're not going to be able to get Medicare until you're over age 65. Open enrollment for Medicare is typically like in December, but there is a special enrollment period that kicks in once medical assistance coverage is lost. And there's a special enrollment period during the unwinding where people can enroll in Medicare for up to 6 months after losing MA. This is going to be especially important for people who delayed enrolling in Medicare because their medical assistance was still on during that continuous coverage requirement, right? So people who turn 65, for example, people who turned 65 over the last 3 years, but they didn't lose their medical assistance because of the continuous coverage requirement. Those folks might have chosen to just stay with their medical assistance because they weren't losing it and it was working for them. Under some circumstances, people who delay enrolling in Medicare can be hit with late enrollment penalties. So folks should take this opportunity during the unwinding where they have these 6 months to enroll in Medicare now to avoid getting hit with any of those late enrollment penalties. So people can contact the Social Security office to apply for Medicare, or they can call the Social Security 1-800 number to apply. PA Medi is the statewide organization that helps people think through Medicare and enroll in Medicare and pick Medicare plans. CARI is one of the PA Medi local sites in Philadelphia. But this number here is the statewide number. People can call there, get some advice and find out who locally they can connect with to get help with Medicare. All right, if none of that works, right, you're not eligible for medical assistance anymore, you can't get CHIP or Penny or Medicare, you can still get healthcare, right? Especially in a city like Philadelphia that has this wonderful network of city health centers and federally qualified health centers and community health clinics. As I'm sure you all know, all of those sites are available to folks regardless of their insurance status. Emergency rooms, of course, cannot turn people away just because they're uninsured. Every hospital has a charity care program to help people pay hospital bills if they're uninsured or underinsured. Excuse me, a lot of hospitals don't do a very good job of telling people about those charity care programs, but they are there and people can use them. Prescription assistance programs generally are available to people regardless of their insurance status as well. All right. All right. So that is what's going to happen in the future. What can people do right now? There are a few things that people can do right now to protect themselves, get themselves ready. The one thing the top line thing, the thing that we've been telling people to do for months and months now is make sure the county assistance office knows your address. A lot of people moved around over the last 3 years. A lot of people moved around a lot. So if the county assistance office doesn't know where you are right now, when they send out that renewal package, it's not going to get to you because it's going to go to the wrong address. So you got to make sure the county assistance office knows your address. You can report a change of address by calling the customer service center, or you can go on Compass. You can check your address there to see where the CAO thinks you are, and then report a new address if you have a new address. The CAO, the Department of Human Services has taken some steps to try to track people down. They've been using the Postal Service's National Change of Address database to try to find people who might have moved but didn't report it to the county assistance office. But that was a little spotty with varied success rates. So we are afraid that there probably are a good chunk of people out there who have moved and either didn't know to report their change of address or tried to report a change of address and it just didn't work. So make sure the CAO knows where you are. Sign up for text messages. If you're not already getting text messages from PADHS, you can sign up to start getting them so that you can get those text reminders about when your renewal is due and how you can submit them. You can sign up on Compass. People will get texts to remind them when their renewal is due. I think, to go back and look, there is some outreach that happens if the renewal goes bad, right? I mean, in addition to the termination notice, there is some additional outreach to tell people about, to remind people that they can do things like ask for reconsideration, and to tell people that they have other health insurance options like Penny and CHIP. Report your language needs to the county assistance office, right? This is a big one. Limited English proficient folks always have a harder time navigating these bureaucracies, and this is going to be a tougher bureaucracy than probably we've ever seen in Pennsylvania, I'll be honest. This spring will be the biggest shift toward less access to benefits than I think I have ever seen in my 15-year career doing this work. And this will hit people who don't read, understand English even harder than it will hit those who can understand those text messages and letters that they're getting. So if the county assistance office knows what your language is, they should be sending you stuff in your language. And if they don't, and they try to cut you off, that will give you their failure to give you stuff in your language will give you an additional tool that you can use to get yourself turned back on real quick. But also, if the county assistance office knows your language, that makes it possible for you to maybe get stuff from the county assistance office that's written in your language and that you can actually understand. That targeted mailing letter that I showed you earlier is going out in 7 languages other than English: Spanish, Russian, Chinese, Vietnamese, Cambodian, Arabic, and Nepali. A lot of the other stuff, though, is only going out in English and Spanish. So there's kind of a mixed bag of language accessibility. But making sure that the county assistance office actually knows what your language needs are is the first step to actually getting the language services that you need. So make sure that they know it. So those are a few ideas for what people can do. You can also go onto Compass, and I believe, I don't use Compass, but I'm almost positive you can go onto Compass and find out when your renewal due date is, right? Just so you have that in your pocket so you know when to expect to get that in the mail. You can also call the customer service center and they can tell you when your renewal due date is. All right. Here are those key messages again, just to remind you. This is what I started with, it's what I'm going to end with. People need to take action to keep their medical assistance on after April 1st. If their MA is cut off, file an appeal. If you miss the appeal deadline, reapply. And remember, you still have healthcare options, even if it turns out you are ineligible for medical assistance. And with that, I think that's the end of my slides. Do we have questions?
Great. Thank you so much, Mary Pat. That was so informative and super helpful. We do have a couple questions in the Q&A. I'm going to get to those first, but if you have a question and you haven't put it in, so you can type it in the Q&A and we'll get to that. Or if you'd like to ask your question live, you can use the raise hand function, and then I'll come in, unmute you so you can ask your question. But let's start with the ones that are in the chat. Some of them you have answered already, but I just want to walk through them to make sure the people that asked them heard the answer in the chat. So for example, Yvonne asked about will Mary get a reminder that the renewal is due in November? So I think, Mary Pat, you went through the 90, 60, and 30-day notice. So if,
Right.
Yvonne, if that didn't fully answer your question, go ahead and put, raise hand or ask that question or ask again if that wasn't clear. And I put a link in the chat to that 30, 60, 90-day plan that you had on the sheet there. Another question was asked just about the renewal process. Is it going to be basically the same amount of time to complete the renewal process as it was in the past, or will there be an extended period of time?
It will be the same amount of time. So people should get their renewal packages around the beginning of the month before the renewal is due, and then the renewal due date is in the middle of the month. So for April, the due dates are probably around April 15th. And then people should be getting their renewal packages within the first week of March. So people should have 30+ days with the renewal package in hand before it'll be due to be returned.
Great, thanks. And then there was a question about, are you recommending that people use Compass? I think you went through Compass and a couple other places that people can go to get assistance. Do you want to say anything more about that?
PADHS definitely recommends that people use Compass. It's really hard to know exactly how this is going to go, but I think because of the CAO staffing problems, especially the staffing problems in Philadelphia with clerical positions, and the clerical positions they're the folks who actually open the envelopes and take the stuff out and scan it into the system. So I am fearful that there will be some backlogs in that process for people submitting paper renewal packages. So I think for people who can use Compass and navigate the online platform, that probably makes the most sense as an attempt to avoid the paper backlogs.
Great, thank you. And I don't know if you can posit a guess on this question from Teresa, but is there a possibility that someone could get a renewal notice erroneously? Like, say they're not up until November, could they get a renewal notice too early? Is there a history of that happening? Have you seen that happen before?
I have not seen that happen before. That would be a new problem. I'm not saying it's impossible, but, and if folks have seen that problem, I certainly would like to hear about it, but that's not a problem we have seen in the past.
And for those asking about, can we get a copy of the presentation? Yes, we'll send out a link to the recording of today's session, as well as a copy of the PowerPoint presentation. So we will send that to you if you registered. If you did not register and would like to get it, you can send us an email, ceoinfo@phila.gov, which I just put in the chat. We'll make sure you get it. So Joanne asked a question that actually I think I asked you once, Mary Pat, and maybe you could answer. If you know that someone is not going to qualify for medical assistance because their income went up, is it worth it for them to reapply to try to restart anyway, or an appeal? I know you always recommend appealing, but what about that initial application?
So I guess the thing that I would say is that medical assistance eligibility is pretty complex. And I 100% know that there are lots of folks on this call who understand medical assistance eligibility very well, and so can make a good determination about whether somebody is in fact eligible or not. And I guess this could change from person to person, depending on what the person's needs are and what person wants, what the medical assistance recipient wants. My instinct would always be to get the renewal in, let the county assistance office make the determination of ineligibility rather than trying to guess myself about what's going to happen during that renewal process. And then if there's a termination notice, right, then there's a decision to make for that individual about whether they want to try to extend their time with medical assistance through an appeal process or just cut it and move on to the next health insurance program. And part of the analysis, I think, will really depend on like what's going on with that person medically. I mean, if they're in the middle of cancer treatment, for example, it's going to be really important that they get to maintain continuous coverage with their medical assistance if possible, because each managed care plan as they move through it are going to have a different network of providers. So just trying to get that person as much continuity in their care and make that transition as kind of long and easy as possible, that's going to be a lot different than like if it's just like a healthy 25-year-old who's just going to need to move from medical assistance to Penny and doesn't expect to have a whole lot of healthcare needs in between if there's some cracks to fall through. So anyway, I think my recommendation, just kind of as a general matter, would be just to get the renewal in, let the CAO make the eligibility determination, and then move on from there, depending on what that eligibility determination is.
And then just a similar follow-up question. Will they automatically be screened for MAUD if they are over income and rejected in their Medicaid application?
They should be, yeah. I mean, so one of the things that federal law requires the county assistance office to do is to consider all categories of medical assistance eligibility before they move forward with a termination. However, we have definitely seen the county assistance office skip over MAUD entirely, especially in Philly. I think we see this problem in Philly a lot, in part because the Philadelphia County Assistance Office, the 11 local district offices don't do MAUD. MAUD is handled entirely by one office at 801 Market Street. So the people in the local offices where individuals can actually walk in and talk to people, they're not thinking about MAUD because they don't do them, right? And so we do see that happen sometimes where MAUD is just skipped over in that whole analysis, and people get a termination notice even though they're eligible for MAUD. The other problem, though, is with MAUD is that you have to prove disability, right? And not everybody has done that. So people might be eligible for MAUD, but the CAO doesn't know it because the CAO doesn't know about their disability. So there are a couple extra steps, unfortunately, that sometimes need to happen in order to get MAUD.
Great. And thank you, Cynthia, for putting that note in the chat. And Yahweh also put a note, but she accidentally just sent it to the host and panelists. So I'm going to put that in the chat that some charity care programs will require a rejection letter for Medicaid. So it's helpful to apply anyway. Thank you for that information. And thank you, Cynthia, for the info about the medical legal community. There's some other specific questions. What about pregnant women who are not eligible for renewals after the end of their pregnancies? Will they be kicked off immediately? And how about EMA receivers? And I think there's another question about emergency Medicaid. Is there any change in emergency Medicaid?
Okay. So taking the pregnant folks first, the question about pregnant folks. So there's now a 12-month postpartum Medicaid eligibility period, medical assistance eligibility period, which is new. It's only been around for not even a year yet. So once a pregnancy ends, that formerly pregnant person is automatically eligible for medical assistance for a full year after the end of the pregnancy. So that's number one. So number two, I guess if somebody's coming up on the end of their postpartum, that 12-month postpartum period, at their next renewal, if the next renewal shows that they are ineligible, then yes, they can get an MA termination notice at that time. And if they're ineligible because their income is too high, they should be referred over to Penny. Excuse me. Emergency Medicaid. Yeah, so I think that we potentially could do a whole other session just on immigrant eligibility and how how immigrants will have trouble moving through this unwinding period. There are no changes with emergency Medicaid. It works just like it did before. There is a new-ish form for emergency Medicaid. The form that I showed you today is the old form, and the old form is still legitimate and you can still use it, and I like the old form better, which is why I show it to people. There is a new form though that is longer and it's more complicated, which is part of the reason why I don't like it. One of the things the new form does though is it makes clear that children with insulin-dependent diabetes, people with cancer, people on dialysis, there are a few others, that those people have emergency medical conditions, right? So that's pretty useful information if you're working with folks with one of those conditions. Besides that, everything about emergency Medicaid is the same now as it was before. There are lots of people who have been on emergency Medicaid throughout the continuous coverage period, right? So people got on emergency Medicaid sometimes at the very beginning in 2020, sometimes because they ended up in the hospital with COVID, right? And they got him on emergency Medicaid to get that covered, and emergency Medicaid has stayed on because the state has been prohibited from terminating. So those folks are going to have to prove an emergency medical condition for the first time, sometimes in 3 years. So I imagine that proving emergency medical conditions is always difficult. And I think it'll be especially difficult for those folks who have just had emergency Medicaid for 3 years and now will realize for the first time that there's this whole emergency medical condition analysis that they have to go through in order to keep the Medicaid they've had for the last 3 years.
So there's a follow-up question that I in the chat, and then Anicia, I see your hand raised, so I'm going to get to you. Elba asks, how about it? I think that it refers to emergency Medicaid. If they have it because of an emergency during pregnancy, will the 12-month coverage apply for them?
No, unfortunately. Yeah, it's not. The 12-month postpartum period is not available to folks who had emergency Medicaid. It's only available to folks with non-emergency Medicaid.
Okay, great. So I'm going to, Anicia, I think you've been unmuted if you'd like to ask your question, and then I'll come back to the questions in the Q&A.
Yeah, my question is, with the emergency for individuals that are immigration, I've been getting a lot of clients where they do have severe conditions, but at the same time, they they only have old records. Does that still count with their application? And does that, make it valid for them to act, valid for the application itself, even though the papers are kind of like maybe like 2 years, and then because they came over here in Philadelphia, and the last time they got checked was like a year ago, and they're not able to get a physician check-in and things like that due to their status, even though we do have clinics that that do help individuals in that matter. Can that still, basically what that comes up to is like with that verification of their old doctors, and physician papers still count towards the application?
So it's hard for me to answer the question without knowing what's in those documents, right? 'Cause with every emergency Medicaid case, it really turns on what's going on with people medically, and do you have paperwork to show it, right? So I think that you could use some old paperwork, but it will be very, very difficult to actually get emergency Medicaid approved if that's all you have. So I think probably what I would do is try to connect those folks with one of the city health centers or a federally qualified health center, somewhere where they can get to see a medical provider that might be able to do that form that we looked at earlier.
Exactly. Yeah. Because I've
given some new records.
Yeah, because I've given clients that, and they just get so, I'm getting the kind of like, I know they're nervous because, they don't have the, the coverage that they have and the Medicare stuff. And they're so eager to get, the Medicaid, the PCOA offices. So it's like, I have to reassure them, like, if you fill out this form, and I give them the list of help centers and stuff like that. So, and the most consistent ones I've been having is the ones that actually, like, they're at levels of like cancer. And I had 3 clients that are levels of like, they either have something that has to deal with like, their heart, or their sugar levels for diabetes. That's the 3 main the individuals that I've been encountering when they really need, the emergency, even though they have old paperwork from the recent, maybe like, last 3 years and not the current year, because they just came over. So it's kind of like, I'm trying to assist them as much as I can with that, but thank you.
Yeah. Emergency Medicaid is really hard. So I try to encourage people as much as possible to not get discouraged and keep trying. And if you want some help, please feel free to email me.
Oh, yes. Thank you so much.
Great, thank you. I see your hand up, Yvonne. I'm going to do some questions from the Q&A, and then I'll come back to you. Now that CHIP is moving to DHS as of April 1st, will applications be completed in the 30 days?
Yeah, the CHIP transition is something I should say first that I don't know a whole lot about. We represent low-income people. Usually our clients, people eligible for CHIP have income that's too high to be my client. So we don't spend a lot of time thinking about CHIP. But I will say that one thing that we have really been strongly encouraging DHS to consider and to do is to delay that CHIP transition, because it's supposed to happen in April, which is the same time this unwinding is starting, and it just seems like a whole lot of work to add to the county assistance office when they already have a whole lot of work to do. So so the short answer to your question is I don't know. And we are hoping that maybe DHS will push that CHIP transition back a little bit so that the CAOs aren't too overwhelmed.
Thank you for that. And are the end of the continuous coverage rules the same for people who are dual eligible, Medicare, Medicaid dual eligibles?
That is a good question. It's a complicated one. So one of the last things that the Trump administration did before it left office was issue a really terrible rule that I and a lot of other health advocates felt very strongly was illegal, And one of the things it did was it said that even despite the continuous coverage requirement, states were allowed to move people who from full Medicaid to just to buy-in only, even though that's a reduction of Medicaid benefits and it's not continuous coverage, right? That's not keeping people continuously covered in the Medicaid they have. That's reducing their Medicaid to something less. So the Trump administration did that. State of Pennsylvania followed that rule and did move people from full Medicaid just to buy-in only. Gets a little more complicated because a federal court in Connecticut just said that the Trump rule was illegal, just like we had said 3 years ago, right? Oh, it's illegal. We're trying to get the state to undo what it's been doing by moving people to buy-in categories only. It's just terrible timing, right? Because the unwinding the continuous coverage period is ending in April. So anyway, so the answer is it didn't apply exactly the same way to people who became eligible for buy-in in the way that the continuous coverage period did not apply in exactly the same way to people who became eligible for buy-in as it did to everybody else. It was illegal, and we're trying to undo that illegal maneuver now, but yeah, that's kind of the answer. It's a little more complicated than that, so I'm not sure who's asking the question. If you want to talk more about it, I'm happy to talk about it.
Thank you. Their name wasn't in the Q&A, but if that person wants to say more, you can do raise hand function and we can take you off mute. And then is aid pending still 14 to 15 days?
Oh, another great question. Yeah. So the law still says the same thing about aid paid pending. So aid paid pending is when you file an appeal and you ask for your medical assistance to stay on while the appeal is pending. Us advocates sometimes refer to it as aid paid pending. So the law on aid paid pending has not changed. It still says 10 to 15 days, but there is a policy, there's an operations memorandum that DHS put out at the very beginning of the public health emergency that said that people can ask for aid paid pending at any point during the appeal period. So if they file the appeal at in any of those 30 days before the appeal deadline runs, they can ask for aid paid pending and get it. That policy is still in place today. And I've been trying to confirm with PADHS that they're going to keep it that way throughout the unwinding, but they haven't confirmed that for me yet. So as of right now, you can ask for and get aid paid pending at any point in the 30 days. You don't have to file your appeal within those first 15 to get it. Whether it's going to stay that way for much longer, I don't know.
Great, thank you. Yvonne, I see that you put something in the Q&A and have your hand raised, so I'm going to unmute you here.
Can you hear me?
Yes, we can. Go ahead.
Yeah, so my concern was Ms. Rodriguez had mentioned that she will refer patients to the city health centers, and just an alert for the patients as you're speaking with them that they will have to register as outpatient and I think be seen by the provider before they complete a form. Other than that, if they have a PCP outside of the health center, that's where they should be referred. That would be the quickest way to get the form completed.
Great, thank you for that. So those were all the questions in the Q&A, and I don't see any other hands raised. Oh, Yvonne, did you raise your hand again?
Oh, sorry.
I lowered you.
Thank you.
Any other questions? Again, put them in the Q&A or do raise hand.
No, I'm good for the last questions. Thank you.
Great, thank you. Okay. I don't see any other questions coming in. You answered a lot and gave us so much information. So, are there any, Carmen, I'm not sure if NY is New York, or maybe you meant to say new resources for veterans. Or, oh, maybe that means any. Are there any resources for veterans? That's what I think that was.
I don't know. Not that I know of. I don't know.
So maybe we can do a little investigation on that and see if we can find anything, get back to you. unless there's anyone else here that knows the answer to that question and wants to put it in the chat. Okay. I want to thank you, Mary Pat. Any closing words before I wrap us up?
No, thank you all so much. And we have handouts that I will send to Beth so that she can share with you.
Great. Thank you so much, Mary Pat. That was so informative. I know I learned a ton today. Really helped kind of pull all these pieces of information we've been hearing from a lot of different places together in one presentation. And I'm so grateful for you spending the time to do that today. Just a couple of reminders to folks. Yes, we will send out the recording. We will send out the slides. CLS is also working on some handouts that should be ready soon. If you registered for this session, we'll send that to you. If you didn't register and we don't have your email address, again, you can email us at ceoinfo@phila.gov, and we'll make sure that you get that as well. Also, the city, we are working in partnership with the health department, CEO, and others, DBIDs and others. We will be creating, the city will be creating a city landing page that will have the basic information along with these other resources that we've talked about that are available to Philadelphians, but unfortunately might not be available to people statewide, like the availability of CLS, the availability of the Benephili centers. You know, FAN does work outside of Philadelphia as well. But so we're going to have a page that we'll send out to everyone with that list of resources for people that need help. Obviously going to Compass is the first thing that they should do, but if they can't do Compass for whatever reason and need an assister, we'll have that information on that page and we'll send that out to you soon. With that, I want to thank everybody for joining this morning. Have a wonderful, I hope you have a long weekend. If not, I hope you have a wonderful short weekend and stay dry today. Thanks, everybody.
Thanks. Bye.